Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Kidney infection. Pyelonephritis. Introduction. Pyelonephritis is a type of urinary tract infection, or UTI, that affects the kidneys. It is also known as a kidney infection or renal infection. Pyelonephritis can affect one or both kidneys. If not treated, pyelonephritis can lead to permanent kidney damage and cause a life-threatening infection. Treatment for a kidney infection usually includes antibiotics. You may need to be treated in a healthcare facility. This program explains pyelonephritis. It discusses the symptoms and causes of the condition, as well as treatment options. Anatomy. The urinary system filters and drains extra water and waste from the body. The urinary system includes 2 kidneys, 2 ureters, the bladder, the urethra. Each kidney is about the size of a fist. The kidneys are located below the ribs. There is 1 kidney on each side of the body. Urine travels from the kidneys down 2 narrow tubes called ureters. The urine is then stored in a balloon-like organ called the bladder. Urine is emptied out of your body through a tube called the urethra. Pyelonephritis usually begins in the urethra and travels up into the kidneys. Symptoms. Symptoms of pyelonephritis may include frequent urination and a strong, constant urge to urinate, burning feeling or pain while urinating, blood or pus in your urine, urine that smells bad. Other symptoms may include fever, nausea or vomiting, chills. Pyelonephritis may also cause pain in your abdomen, back, groin, side. If you have any signs or symptoms of a kidney infection, contact your healthcare provider right away. A severe infection could lead to life-threatening complications. Possible complications include permanent kidney damage that leads to chronic kidney disease. Pyelonephritis bacteria could infect your blood. Women who develop a kidney infection during pregnancy may have an increased risk of delivering babies with a low birth weight.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Causes. Pyelonephritis usually happens when bacteria enter your urinary tract through the urethra and begin to multiply. Pyelonephritis also can happen if bacteria from an infection elsewhere in your body spread through your bloodstream to your kidneys. Rarely, kidney infections can happen after kidney surgery. Women have a greater risk of kidney infection than men. This is because a woman's urethra is much shorter than a man's. This means that bacteria have less distance to travel from outside the body to the bladder. Because a woman's urethra is close to the vagina and anus, there is an increased chance for bacteria to enter the bladder. A bladder infection can spread to the kidneys. A blockage in the urinary tract may stop urine from flowing normally. It may stop you from being able to fully empty your bladder when you urinate. Harmful bacteria may grow in the remaining urine. The urinary tract may be blocked by a kidney stone, structural problems in your urinary system. In men, an enlarged prostate gland may block the urinary tract. Certain medical conditions that affect your immune system, such as diabetes, increase your risk of kidney infection. Some medications also increase your risk. Nerve or spinal cord damage may lower your ability to sense the symptoms of a bladder infection. You may not know that your infection has gotten worse. Using a urinary catheter for a long time can increase your risk of getting a kidney infection. Urinary catheters are tubes used to drain urine from the bladder. A condition called vesicoureteral reflux causes small amounts of urine to flow the wrong way. The urine backs up into your kidneys and ureters. People with this condition may have kidney infections often. Diagnosis. To diagnose pyelonephritis, your healthcare provider will perform a physical exam. He or she will ask you questions about your personal and family medical history. A urine sample will be tested for bacteria, blood, or pus. An ultrasound may also be done to check for blockages in the urinary tract. An ultrasound is an imaging test that uses sound waves to create images of structures inside the body. Other imaging tests may also be done to examine the bladder, urethra, or kidneys. Treatment. Antibiotics are usually the main treatment option for kidney infections. The type of medication you are prescribed and how long you will need to take it depends on your health and the kind of bacteria found in your urine tests. The signs and symptoms of a kidney infection usually start to clear up within a few days of treatment, but you may need to take antibiotics for a week or longer. Take all of your medicine and follow your healthcare provider's directions. This will make sure that the infection is completely gone. Do not stop taking your medication before you are supposed to, even if you start to feel better. You may need to go to a healthcare facility for treatment. Treatment may include antibiotics that you receive intravenously, which means through a vein in your arm. If you get a lot of kidney infections, your healthcare provider may recommend that you see a specialist to help identify and treat the cause of frequent infections. You can help reduce pain while you are healing by using a heating pad on your abdomen, back, or side. Drinking plenty of fluids helps flush bacteria from the urinary tract. Avoid alcohol or caffeine until your infection is gone. Prevention. You can lower your risk for pyelonephritis by drinking plenty of fluids, especially water, to help clear bacteria from your body when you urinate. Urinating frequently. Urinating as soon as possible after having sex to clear bacteria from the urethra. You can also lower your risk by wiping carefully. Women should wipe front to back after urinating or having bowel movements. This can help prevent bacteria from spreading to the urethra. Avoiding feminine products such as douches or deodorant sprays. These products can irritate your urethra.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Pyelonephritis is a type of urinary tract infection, or UTI, that affects the kidneys. It is also known as a kidney infection or renal infection. Pyelonephritis can affect one or both kidneys. Symptoms of pyelonephritis may include frequent urination and a strong, constant urge to urinate, burning feeling or pain while urinating, blood or pus in your urine. Other symptoms of pyelonephritis may include urine that smells bad, fever, nausea or vomiting, chills. Pyelonephritis usually happens when bacteria enter your urinary tract through the urethra and begin to multiply. Pyelonephritis also can happen if bacteria from an infection elsewhere in your body spread through your bloodstream to your kidneys. To diagnose pyelonephritis, your healthcare provider will perform a physical exam. He or she will ask you questions about your personal and family medical history. A urine sample will be tested for bacteria, blood, or pus. Antibiotics are usually the main treatment option for kidney infections. The type of medication you are prescribed and how long you will need to take it depends on your health and the kind of bacteria found in your urine tests. If you have any signs or symptoms of a kidney infection, contact your healthcare provider right away. Take all of your medicine and follow your healthcare provider's directions. This will make sure that the infection is completely gone.
Thank you for using Explain.